Good evening. Thank you everyone for joining our first Chat with Alumni series of the spring semester. My name is Krista, and we're very excited today to have two fantastic alumni who are not only sisters, but twins, if I have that correctly. Yes? All right, and they're both at two different osteopathic medical schools. So we're very excited, especially for our applicants who may be considering osteopathic medical school, to learn more about what that means and what your experiences are like. So I'm going to let Erin and Kalaya, two of our advisors, introduce themselves, and then Manisha, please take it away.
Good evening, everybody. I'm Erin Saramboli. I am the Director of University and Pre-Professional Advising. I am excited to see you both talking today and learn more about your experiences in medical school.
Hello, everyone. My name is Kalaya Aaron, and I'm an advisor in the pre-med advising office, as well as the Rural Health Scholars Professions program. I am delighted to hear more about osteopathic medicine from you guys tonight, and I will stop talking now.
And my name's Manisha. I'm a student worker at one of the loveliest places to work at UConn's campus, the Pre-Med Pre-Dental Advising Office. And I will just help moderate this chat, and then it's all going to be very casual. And basically, I would love to learn more also as well as a pre-med student what Shauna and Nasli have to tell us about osteopathic medicine. But Shauna, would you like to start and introduce yourself and maybe tell us when you graduated at UConn and what you majored in and what you're doing now?
Hi, sure. So I'm just going to share a presentation that we made, and we actually wanted Nasli to start off, so I'll just have her start. Just let me know if you can see my screen. Can you see that?
Yeah, we can see it, Shauna.
Okay. And I'm just gonna play from the start. Can you see this? Just the first slide. Okay.
Yeah.
So I'm Shauna, and I'm just really excited to talk to everyone. So today's presentation is going to have a focus on osteopathic medicine. And Nasli, you can just introduce yourself.
Okay, so hi everybody. My name's Nasli. I'm currently a second-year medical student at Nova Southeastern University, College of Osteopathic Medicine. There's two campuses. There's one in Fort Lauderdale, Florida, and there's also one in Tampa, Florida. So I'm at the Tampa campus. I graduated in UConn in 2019. I was an MCB major in the honors program. I just have a list of some of the activities that I took part in when I was an undergrad. I performed lab research at UConn Health. I was in the neuroscience department there for about 2.5 years. So that was a great experience. I also was in the URAP program here, well, at UConn. So that was in connection with CCMC. So students would basically go into the Children's Emergency Department and conduct clinical research. So that was also a phenomenal experience. I took part in the Collegiate Health Service Corps, and basically that's a great program that they have at UConn where students basically could go to a site that they have. For me, it was a homeless population, a soup kitchen that we would work with about every 2 weeks. So we would go in and we would talk to the population there, and we would see what they would be interested in learning about health-wise, whether it was diabetes or hygiene or how much exercise should you get per day, anything health-related that they would want to know. We would come in and we would provide information for them, make it a really casual conversation where we could talk openly about the particular subject. And in the end, just leave them with information that they could go to, whether it was a nearby health center or urgent cares or anything in the area that they might need after we left. We provided that with them. So that was like a great experience as well. I also took part in the Wyndham Heights tutoring program, tutoring elementary school students. And since I am Iranian, Shauna and I, we were in the Iranian Student Association, and I was also in the French Club as well. And I did not have a growth year. I just applied straight through. So right after I graduated, I came to Nova. Okay. So I'm Shauna, and I am currently attending the University of New England College of Osteopathic Medicine. I graduated from UConn in 2019, and I majored in molecular and cell biology. So while I was an undergrad, I was involved in a lot of different activities. I did research for 2.5 years in the Department of Pharmaceutical Sciences. I was also part of the URAT program, so I did clinical research through them. I was involved and held positions in several organizations, including Partners in Health Engage, the Iranian Student Association of UConn, and the Public Health House Learning Community. And Nazli already explained a little bit about the Collegiate Health Service Corps, so I was also part of that. And that was just a really great experience to go into a place with a group of people, and they would tell you what they wanted to learn about, and you would make lesson plans and present on the information the next week. It really helped you improve your communication skills. And I also did a mission trip to Nicaragua my freshman year of UConn. And I did take a growth year in between undergrad and med school. So I was an AmeriCorps member, and I was part of an organization called Service to Improve Community Health. And part of that program, I was stationed at a federally qualified health center. So the one that I was at was called First Choice in East Hartford. And I had a position there as a population health analyst. So I was able to look at patient data, see what areas we needed to improve on, and see what steps we could take to do that. I was also able to interact with patients directly. As part of the AmeriCorps role, I was also speaking to community members. So I was trying to increase health insurance literacy and also was giving health education information to the public. So my role while at UConn in the Collegiate Health Service Corps really did prepare me for my role as an AmeriCorps member. So we just wanted to answer one of these questions that we thought would be helpful for pre-meds who are interested in osteopathic medicine or are interested in applying to DO schools. So that was what informed Nasli and I to apply to osteopathic medical schools. So to start out, Nasli and I both had a pediatrician who was a DO. So that was one of our first interactions with a DO and knowing what osteopathic medicine was. I also shadowed a DO while I was at First Choice Health Center during my gap year. And we both really liked the idea that osteopathic medicine can allow you to treat patients with a hands-on technique, and it can allow immediate relief. Also, when you're learning osteopathic medicine, you really gain a greater background of anatomy, and then you're able to apply your knowledge clinically. So there are 4 tenets of osteopathic medicine, and DO schools really emphasize all of these tenets as a way to practice and approach your patients as future physicians. So the first one being the body is a unit, the person is a unit of body, mind, and spirit. So what this really means is that the patient isn't just a patient with a somatic complaint, but you have to consider other aspects of the patient's life and really provide a holistic outlook to gain a better understanding of the patient's situation. The second, the body is capable of self-regulation, self-healing, and maintenance. So in DO school, they really emphasize how we can help put the body back into a state of homeostasis, of where it wants to be naturally, because the body actually has this capability. Number three, structure and function are reciprocally interrelated. And this isn't just a DO principle. Even while I was in my biology classes at UConn, this was a topic that was heavily emphasized. And number four, rational treatment is based upon an understanding of the basic principles of body unity, self-regulation, and the interrelationship of structure and function.
So here's a lot of purposes that osteopathic medicine is used for. Mainly, it is to maintain a patient's health and restore physiological function. And there's also many reasons why someone would use it. So I just listed some reasons, including that you can relieve pain, you can treat hypertonicity, so that's when your muscle is tight. You can also treat a tender point, so that's a point in a muscle that is more tender than the surrounding area. You can also treat asymmetry, so if someone's shoulder is higher than the other one, you could treat that. You can help improve a person's range of motion. So if someone can flex their right hip more than their left hip, that's something you could treat. It can also improve breathing depending on what techniques you use, and it can also improve lymphatic drainage.
So these are some of the very common techniques of osteopathic medicine that basically every DO student will learn. The first is called counterstrain, and like Shauna kind of said, there's very small, discrete areas in the muscles that elicit pain when they're being palpated by a physician. So basically what happens in this technique is that the physician will place their hands directly on that tender point and put the patient in such a position where that pain at that specific point is at its minimal, like there's no pain. And basically the physician puts that patient there in that position for 90 seconds and then passively returns. And at that point, most of the pain should be reduced. Another technique is called soft tissue techniques. And my classmates and I help each other with this all the time, basically to relax hypertonic muscles. You know, if you're studying for an exam and your neck muscles are really tight, my classmates and I would always do soft tissue techniques to help relax those hypertonic muscles and also improve local circulation, as it says here. Muscle energy technique, that's basically where every joint and every muscle has some type of barrier. And sometimes that joint can be stuck in a specific barrier. It won't move past that barrier. So in muscle energy, basically the provider and the patient will work together using a counterforce to basically put that joint closer and closer to that restrictive barrier until it's overcome. So the purpose of this technique is really to just increase the range of motion. And finally, a thrust technique, also called high velocity, low amplitude techniques. In this technique, the physician will use their hands and they'll find a joint that's maybe not moving as well, or maybe it's not symmetrically in line with other joints. And the physician will basically use a quick, very short thrust to overcome that barrier. And sometimes you can hear a popping noise actually, and that's just really to you basically know that the joint is put back into place at that point. It's not necessary to hear that popping noise, but sometimes you can hear it, which is really cool.
I just saw that there's a question in the chat that I can answer. It asks, do you practice those techniques in class as you learn? Are you tested on performing these techniques? So every week, Nosley and I both have OMM, which stands for Osteopathic Manipulative Medicine labs. So you are learning techniques, new ones every week, and you are going to be tested on them. So I know at UNE we have a performance center, so you will go there You'll also be tested on clinical skills at the same time, and you will be asked by a faculty member to perform a certain technique, or they'll give you a scenario like a patient comes in with this issue. What do you do? So then you have to know which technique to use, and then you'll do it right now because of COVID times. We're doing it on our roommates because we don't want to have as much contact with anyone who we don't live with. In the past, you would probably be assigned to a random student. And in second year, so I'm currently at first year, in second year, you'll have patients, like people from the community who you'll perform these techniques on. And we also talk about that a little bit later in the presentation, so I hope that answered your question. So I just wanted to give an example of osteopathic medicine technique, because I think as much as we can explain what it is and give you definitions, I think it's really helpful to have a visual just to see and have a specific example of what it means. So I wanted to give an example of a high velocity, low amplitude technique that Nosley just explained. This specific one that I chose is a double arm thrust, and it's one of my favorites. But basically, what you would use this for is if someone has a transverse process that's more prominent than the other. So just to give some basic anatomy, I have a photo of a spine. So you'll have your spinous processes right down the middle, and then more lateral, which is more towards the side of the transverse process, you'll have the spinous processes, you'll have the transverse processes. And you can feel this on someone's back. And if one is more prominent than the other, the person has asymmetry. They can also have pain. So the reason why this would happen is if there's a vertebral segment that becomes rotated, and you can treat this quickly with a technique. So you as a provider would put the patient in a certain position. So I have an image of it, and the patient would also be in a specific position. And then you would do a quick thrust by putting your body weight onto them. And it gives direct relief and correction immediately. So this is just one example of how OMM can be used to treat someone quickly, and it's a hands-on technique. So you're using your hands a lot with your patients, which is one of the reasons some people want to go into studying OMM. And then I just wanted to give another example. So for muscle energy, which was one thing that Nosley had defined beforehand, if a patient comes in with an internally rotated hip, you would want to externally rotate it so that the person becomes more symmetric. And so with muscle energy, you would externally rotate their hip, and they would keep internally rotating it, having a counter force against you. And you would do this several times, and that can help treat the asymmetry that the person has.
So OMM can be used to treat like a wide variety of conditions that a large majority of the population has. Like I said before, my classmates and I, sometimes studying for exams, we would get a lot of headaches and we would treat each other using OMM. So that's been really useful. Also, I have here just a list that you guys can go through, but specifically I wanted to point out constipation, because there's actually ways using OMM that you can activate the parasympathetic nervous system, and that can actually alleviate the constipation. Also asthma, there are ways using OMM that you can activate the sympathetic nervous system to bronchodilate your airways and help alleviate, an acute exacerbation that a patient may have. I also have here edema. There's ways that you can allow the lymphatic fluid to flow freely throughout the body and not just be so congested in one specific area.
So we wanted to talk a little bit about the curriculum at both of our schools. So it is basically the same as an MD school, but you would also, in addition, have 200 to 300 hours of OMM training. Things have changed slightly because of COVID. So at my school, we currently have a 4-hour OMM lab per week. Before COVID, our class, which is 180 students, would be split into two, and then all of the students would go into a huge room, and there would be a faculty member at the front teaching everyone the techniques, and there would be multiple faculty members walking around the room helping everyone. But because of COVID, we are now in a cohort model, so everyone is in a group of 8, and each group of 8 has one faculty member teaching you. I actually think it's a benefit because you get more one-on-one time with a faculty member, and you get that individualized one-on-one time with them to improve your techniques. And we do have exams for OMM. You usually have 2 to 3 per semester that are multiple choice. And in addition, you are tested at the Clinical Performance Center with a faculty member observing you, and you'll also be recorded. So at Nova, basically pre-COVID, we had one 3-hour OMM lab per week. But since COVID times have happened, we missed out on all of our labs for 10 months. So now we're kind of getting back into the swing of lab and having to make up all of the labs that we missed. So now it's more like 3 to 4 labs a week, and they're about an hour and a half in length. Pre-COVID, the faculty member would train about 10 students in the lab, and the lab would contain about 80 students total. Now it is still about 10. It might be a little more like, 20 to 20 about. It is a little bit more just because we don't, the lab groups have decreased in size. But in that regard, it hasn't really changed that much. We do have OMM practicals. Pre-COVID, it used to be about once every 6 or 7 weeks, and now it's about every 2 weeks. So you have to demonstrate all the techniques that you've learned on your partner. And at Nova, it is required that you show at least a 50% improvement in the patient's condition, and that would be defined by the faculty member was grading you. They would come after you perform your treatment, and they would check themselves to see if it's actually improved or not. I just see, oh, sorry. Go ahead. Anna. Oh, I was just going to say that there is another question in the chat. And the question is, would DOs prescribe medications in addition to using OMM? So DOs can be any type of doctor they want to be, like any type of specialty they can go into. And DOs will still prescribe medication, just like MD doctors, especially if it's needed. We just have, in addition to what an MD can do, you have the ability to also use your OMM techniques. So it's just an extra tool in the toolbox that you can bring out. Right. So like I was saying before, let's say a patient came in with an exacerbated asthma attack. So obviously it wouldn't be your primary go-to to just use OMM. Obviously this patient needs albuterol, oxygen, like other medications. But it is, like Sean was saying, one thing that you can use that helps. And again, just another tool in the toolbox that really comes in handy. So are you, Shauna? Do you want me to go back? Yeah, I had 2 more. Just no, you're fine. Also at Nova, so we do have 1 to 2 OMM lectures per week, which is really manageable. And then you have written exams that are multiple choice. And you do have the opportunity at Nova to shadow in OMM clinics with our faculty, and they actually do a little more than just shadow. Like you can actually become involved in the actual treatment of patients with the faculty, since you do have a foundation
from your labs, the faculty are comfortable and like helping, letting you learn along with the other students. Also, just a side note for Nova, there is one specific professor who he is a physician for professional boxers, so he goes to fights a lot of the times, and he'll take Nova students with him to these fights. And if one of the boxers sustains an injury, he's there on call, ready to treat them. Oftentimes he uses OMM right on the scene, so the students can shadow that as well. So that's just a little cool side note that I wanted to throw in there. And again, at NSU, we do have OMM clinics that students can go in and help either like work with the faculty to help treat the patient if they want to, or they can just shadow as well. So I just wanted to talk a little bit about the board exams for osteopathic medicine. What we have is COMLEX level 1, level 2, level 3, whereas the MD counterparts have USMLE step 1, step 2, step 3. So as a DO student, you can take the USMLE if you choose to. I know myself and a lot of other of my classmates will take the USMLE. It is on par, the COMLEX and USMLE, they're both equal level of difficulty. It's just that the COMLEX has OMM specific questions that the USMLE does not have.
So since this presentation is for people who are interested in knowing more about OMM and applying to osteo or DO schools, I did want to give some interview tips specific to DO schools. And one of them is that they do expect you to understand and memorize the 4 tenets of osteopathic medicine. During interviews, they might ask you to list all 4 of them. So just understanding what osteopathic medicine is, you don't have to be an expert, but just having the basic knowledge of it and being able to explain why you want to go into it and if you had any exposure to it. If you are interested in primary care, that's something that you would want to bring up during your interview. And I just have some general interview tips as well. So another one of the common questions is, do I need to shadow a DO to apply? And our answer to that is, if you have the opportunity to, you definitely should. Not only because it will help with, you know, your other portions of your interview, maybe being able to bring up a technique that you saw being done and you want to talk about that in your interview, but also some schools do require a DO letter of recommendation. Some do not. It's really school specific. So if you're thinking DO, then it would be a good idea to contact either a relative or a friend or any DO that you know to really get that experience. But in the end, all DO schools do look for your understanding of osteopathic medicine somehow. So whether that be through shadowing or any other experience, they do want to see that you have that foundation. Also with COVID, we know it's hard to do that. So I think schools also are understanding of that currently. The second question is, can DOs pursue any specialty that they want? And the answer to that is yes. Many match into very competitive specialties, but it really is a combination of all things that factor into what specialty you want. Your board scores, research, extracurriculars, and your clinical grades all really factor into that. And we just have a statistic here in the 2020 match. 56% of DO graduates matched into some type of primary care. But again, any DO is freely allowed to apply into any specialty that they want, and many have successfully matched. And you can pursue a fellowship if you want to. We also just wanted to explain how we find balance in and out of the classroom. So at UNE, I think our school is really good at helping students find this balance. We have 2 to 3 blocks this semester. So at the end of a block, you'll have cumulative exams. So you have a cumulative exam for anatomy, OMM, and medical knowledge. And after you have that week, you get a week off, which is really nice. And in Maine, our school is located 25 minutes from Portland, which is really nice. And there's just so many things to do. So students will go skiing or ice skating, surfing. They'll go sightseeing. There's a lot of lighthouses to see, or hiking. We have Acadia National Park a few hours away.
And at NSU, I think along with any medical school, most of your time will be spent studying, but that doesn't mean that you can't give yourself a break and give yourself time to rewind. So usually what I would do is if we had an exam in the morning, I would take the afternoon off. I would just not do anything school related and try to like de-stress. Thankfully in Florida, I'm super close to the beach. I'm about 15 minutes away. So I would usually go there and walk or just hang out. There's also really great downtown life pre-COVID. Since I'm from Tampa, a lot of the students would go to downtown Tampa. St. Petersburg is another really fun town that's close by. Dunedin is also really close by. And then on the opposite side of Florida, where they have the other campus in Fort Lauderdale. I know there's a lot going on in Fort Lauderdale, and Miami is really close. So a lot of the students do take advantage of these different towns to de-stress and unwind after their exams. Something different from UNE is that Nova does not have cumulative exams. We are only tested on material that we've learned for the past 2 or 3 weeks, but never like something like 1 or 2 months in advance, or 1 or 2 months before that test. The only exception to that is OMM, and that really is for your benefit because even in the lab, you're expected to maintain that knowledge of different techniques because sometimes they do build on each other. So that's the only class that's cumulative for us.
And we just wanted to give our contact information. If anyone wants to contact us or has any questions, our emails are here, and these are the ones that we check the most often. I'm not sure how I stop sharing.
Usually if you scroll somewhere near the top, you'll find, oh, there you go.
Does anyone have any questions? Also, just wanted to shout out to someone I know. Hi, Seema.
Hi, it's nice to see you. I have a question actually.
Okay.
How were your interviews different? Because I think you applied to both MD and DO schools. So was it the same? Was the application process the same? Yeah.
So for DO schools, it is a different application process. You have to go through, do you know what, Nasli, what it was?
I can't remember actually what the name of it
It's
is. It's a whole separate. Oh yeah,
Just did this last night. Yep.
Yeah, ACOMAs. So it's like a cute. It's like a different like thing entirely than AAMC. I think was the MD version. I can't remember.
AMCAS.
AMCAS. But other than that, the application process isn't too different. I mean, you still have to list your extracurriculars and your grades and your letters of recommendation. So it's really similar in that regard. Interview-wise, which is another thing you asked, like we said, they do really look for your understanding of osteopathic medicine somehow. So whether you want to provide the experience that you've had or talk about the 4 tenets that we described, that's something that they look for. But other than that, the interview process isn't really that different, at least in my experience.
I do remember that I believe ACOMAS, like their word count or character count was a little bit less. So you might need to adjust some of your essays when doing that. Some people also will adjust their essays for their DO application just to talk more about osteopathic medicine or primary care in it. Yeah, and just what Nosley said for the interview, just being able to explain why you want to go into osteopathic medicine or bringing more out for if you do have an interest in primary care, that's something that you could bring up. And just knowing that they might expect you to list the 4 tenants right there, because that is something that happens very often.
Thank you. Good advice.
I have a question actually. First of all, thank you guys for presenting. That was so informative and actually answered a ton of questions that I was going to ask anyway. So is there one experience in particular that you did that you had in undergrad, whether it be like a class at UConn or an extracurricular activity like research or a club that had the most impact on you and ultimately your decision to go to a DO school?
At least for me personally, I wouldn't say there was one experience. You know, I think like we mentioned, we did have a DO physician as our pediatrician, so that was kind of like the first like inspiring thing that we came across. But for me personally, you know, whether you're an MD or a DO, you are gonna be practicing as a physician either way. And I think that what inspired me to medicine would have been the same, whether it did go to an MD or a DO school. It's just that the DO has that added benefit of, you know, being able to treat patients hands-on, using the techniques that we mentioned, having that extra tool in your toolbox. But for me, there wasn't really one specific pinpoint experience that I could kind of fall back on. So you asked for an experience at UConn. I'm not really sure if there's one specific one for UConn. But I know that during my gap year, while I was at the Federally Qualified Health Center, I was able to shadow a DO who went to UNECOM. So just seeing a student who, or someone who was a student at my school and seeing how she practices in real life as a physician, that was something that definitely drew me to osteopathic medicine as well. I'm personally interested in OBGYN currently, and we did have a family friend who was a DO and an OBGYN. So just being able to see what their path was to get to doing something that you want to do, that was something that played into the role that I wanted to go to a DO school.
I just, sorry. Thank you for coming. I'm also Persian, so Iranian Student Association. My question is, did you ever have moments of doubt throughout your undergrad career? And if you did, how did you deal with that?
Sure. I can talk on this a little bit. So I had a great time at UConn and really loved my classes. I personally thought the hardest thing for me was the MCAT. It's this huge exam and you have to know a lot for it. And even if you know everything, you have to practice a lot. And also finding the time to do all that while also taking classes and doing your extracurriculars is difficult. So I did end up taking the growth year in between undergrad and going to med school. And part of the reason I ended up doing that was because I wanted more time to study for my MCAT. And just now that I'm a first year medical student, I've been meeting so many other medical students. I'm sure some of you maybe know that the average age for going to medical school, I believe, is around 24. So people are taking an average of 2 years in between. But now that I'm here, I'm meeting applicants who are of a whole range of ages. And so I'm just meeting so many people who are like 27, 28. Just a fun fact, one of the oldest students at UNECOM was 55 years old. So I think that if you are having a hard time with something or you want to make sure that your application is strong before applying, don't be stressed if you have to take a few years off or do something that you think will benefit you. I do know a lot of students here that I've met have taken post-bac, have done post-bac programs or have gotten their master's before coming. So that's another thing that I have become more aware of and how common it is.
And just to bounce off of that, I think what really helped me was finding an older student who has been through the process before. So I remember when I was applying to medical schools, I actually reached out to a third year medical student who was at the school that I was interested in going. And I talked to her, and she talked to me about her school. She talked to me about what it was like being in the hospital, what it was like being a medical student. And to me, that was really inspiring, especially at the point that I was in, like taking the MCAT and getting letters of rec. It's all a very stressful process. But if you can find somebody who's been through it and know that it's just, part of the process and you will get through it and you can make it to the point that you want to be, to me that's really inspiring, and I'm even doing that now, reaching out to upper level students, third and fourth year students, reaching out to residents. It's not really a undergrad specific thing. You can actually do this for any point of your medical training. Just having that person who's been through it and can guide you through it, I think, is super important and really inspiring.
I have a question just about kind of like the same thing, like the process of like kind of finding someone to ask like these kinds of questions to. But how were you guys able to narrow down like where you wanted to go to school and like applying? Because I know there's like so many options, and that's like another part of the puzzle that like I haven't really started thinking about. Like I'm a sophomore right now, so it's like time to like kind of start thinking about that. So like what was something that helped you guys with that process?
I know that I personally actually went to an event that was a DO specific event. So this was pre-COVID, but I'm sure they might be doing these online. So you might be able to find events like a DO virtual fair or something, and you have a bunch of representatives from different schools coming, and that way you can talk to a representative from a different school and learn about them and see if you would want to apply there.
Also, to add on to that, it's really helpful to go onto the school's website that you want to go onto and just look at, what are their board scores? How many students match at their school? These are all really important things that you want to look into in order to make an informed decision. For me, one thing, well, that's something that I did, but I also really factored in location to my decision. I know that I didn't want to be on the west coast of the country. Since I'm from Connecticut, I at least wanted to stay on the East Coast somehow. So that was really important to me. But I think especially hopping on the school's website, looking at their stats, looking at their programs and location are all of the things that I really looked for in the school.
You can also contact a school and ask them to set you up with a student at that school, with which they would be glad to do, and you can talk with students at each school and ask them any questions that you want. So that is something that I did for UNECOM. Yeah, I was just looking at the chat. Okay. But yes, I did contact a student who went to my current school before I attended here just to ask about it and learn more about it.
I think that's really that's what started this series that we're doing at the med pre-dental advising office, just because we know how important it is to get advice from students who graduated from UConn and are in their medical journeys and in medical school, because sometimes even for me as a senior, a second semester senior, it's hard to see where it ends, or just being appreciative of the process, because I know it's kind of a long one. But thank you guys for again reaching out to do this, because these the series that we've been doing has been really, really helpful for students.
Sure. Yeah. We really enjoyed talking with you guys, and we're glad. We hope that we can provide you with more information. And again, our emails are in the PowerPoint, so if you have any questions, don't hesitate to reach out to us, and we'll get back to you.
I think we're going to even include some of your interviewing advice in our interviewing workshop down the road over the summer. It's fantastic. This has been so informative. We might have time for 1 or 2 more questions. Would anyone like to speak up or type in the chat?
I have a question. So I was just wondering about what are the resources available at your school, whether it be academic or professional, career-wise, or even mental.
So I can talk about that a little bit. At least at Nova, we utilize tutoring services for students who do need it. So that can be a student who did really well in a class, like an upper level student, maybe a second or third year, can actually go in and help, say, a first year student if they were struggling, and tutor with them. We also have something called study tables that happen about every week, where third or fourth year students or second year students who have really mastered the material the first time around will host presentations, and anyone can attend if they want to. It's over Zoom now, but it's a really informative way to make sure you have the foundations of whatever that block is. So that's been something that's really helpful for students. Apart from that, you can always email the professors. Their door is always open for you, and they're more than happy to help you with anything that you're having trouble in. In terms of mental health wise, we do have resources at our campus. Now, unfortunately, everything is online, but there is a mental health counselor that you can always Zoom with if you're having an issue, and they'll get back to you, and you can just have a meeting on the spot. So it's been really great for students, and something that definitely is really helpful.
I know at UNECOM, as well as most medical schools, they have something called a fellow. So a fellow is a student who has done well in their first and second years, and in between their third and fourth year, or after their fourth year, they will actually stay an extra year at the school, and they will help teach the first and second year medical students. And that, I believe, fellows make such a huge difference in helping you learn. We also have tutors. We have office hours as well. And in terms of mental health, so UNECOM is, well, a lot of medical schools do have this, but it's part of it. Our campus is at the undergrad campus. But side note, our campus is actually moving to Portland in 3 years or 2 years. I'm not sure. That was new news this year. So that is happening. I'm not sure when you're applying, but it is something exciting if you are looking to be more in a city-ish area. And also the dental schools and the PA schools are there too, so you'll be interacting with those if you're applying later on. But for mental health, I'm sure the UN Econ students could also use the resources of the undergrads. So I know we all use the same health services. So, I mean, I personally like being on an undergrad campus. I loved being at UConn. Here, you can also use the same like common buildings with the undergrads as well. So I'm sure they have resources like that. We also have a lot of clubs at UNECOM. So some of them would be like a meditation club or a yoga club. So those could also help with mental health. Also, we are like surrounded by beaches, and I think that is really fun to go to. It's really pretty, some of the sites here, so I'm sure that helps with mental health.
Thank you.
Mhm.
Also, one more question. So I'm not sure if you guys like talked about it before at the beginning of the meeting, kind of like joined late,
Mhm.
but for both of your schools, are they like you do like 2 years of like just like studying basically, and then like the next 2 years are like you do your like clinical rotations? Is that how it works?
Yeah, that's actually a really good question that we didn't think about talking about. And it's actually a really important question to ask medical schools where they do their rotations, because rotations can be really important, especially if you make a connection for residency, if you like want to go somewhere specific for residency. But for UNECOM, all of our rotation areas are in New England, and they're just in all different states in New England. And we actually do, so you're correct in the first 2 years being studying and the next 2 years being rotations. And the way our school does it is that you will rank your top 3 sites that you want to go to, and the whole class will actually vote on which site you should go to, and you give your reasons for which ones. Like you would say, I really want to go to this site because of these reasons, versus if someone says, I really want to go to that site for these reasons, and the school votes. UNECOM actually gives the whole class a choice if you want to do a computer-based model where the computer chooses for you, or if your classmates choose for you. And every single year, the whole class decides that they would rather have their classmates choose for them than a computer.
The process is very different at Nova. Our rotations, most of them are in the state of Florida. We do have a couple in New York, actually, but most of them are in Florida. As far as how we are put into those rotations, there are 20 sites that we can choose from, and we rank 1 through 20. And after that, it's just basically a lottery system. So I guess it is computer based. And if you're number 1, then you can get your number 1 pick. And if you're number 20, then you get, unfortunately, your last pick. But either way, you learn at the end of the day the same thing. So it doesn't really matter where you go. But we don't have our classmates choose for us.
And I think if you end up not liking your site and someone doesn't like their site, you could see if you could switch.
It's really cool. Thank you.
Mhm.
All right, we do want to be respectful of your time. We're sure you have very busy schedules when you're not at the beach or off ice skating or but this has been incredibly informative. I know that this will serve as an incredible resource. I just got a message saying that you both deserve a standing ovation, and that is absolutely true. All of your answers were just so comprehensive and I was going to say comprehensive and concise, but informative, knowledgeable. So we really appreciate you sharing all of your expertise with us today. Thank you as well for sharing your email addresses. That's a really big help. So everyone, please take note. All right, with that said, everyone, best wishes and happy almost Friday.
Thank you. Nice
Thank
to meet everybody.
Thank you.
Thank you.
Thank you.